The governors of Ohio, New York, and Indiana, each sounding an alarm today. Hospitals are filling up, and healthcare workers are feeling the strain. One of the biggest hospitals in Wisconsin is now at capacity, unable to accept more patients. Another facility is calling in the U.S. Navy to help handle the caseload. And we may be just at the beginning of what the World Health Organization chief warns may be a tsunami of Delta and Omicron cases. Back with us tonight, Dr. Celine Gounder, Clinical Assistant Professor of Medicine and Infectious Diseases at the NYU School of Medicine and Bellevue Hospital. She was part of a panel that advised the Biden transition team on COVID-19, and she hosts a weekly podcast on the impact of coronavirus called Epidemic. It's good to have you here, and I want to start with that possible tsunami referenced by the WHO chief. There was a New York Times headline tonight that said, New York struggles to keep running under Omicron. I mean, everything from a huge percentage of EMTs calling out sick, subway lines shutting down because they don't have people. But there was this one very real example of a 68-year-old resident I want to read for you. It says, in downtown Brooklyn, Wanda Ortiz, who has had fever, body aches, and a scratchy throat since Christmas, summoned the strength to head over to the City MD on Atlantic Avenue Wednesday morning to get tested. The clinic was dark. She wandered off to find another testing site, hoping she would not have to stand in line too long in the cold. It's just one of thousands, if not millions, of stories across the country. How worried are you about a possible tsunami and the closures that brings, the ability to help the sick looking for help?
Well, Chris, I'm on service at Bellevue Hospital right now, and a number of our own staff are out sick. Something like a third, I believe, of our nurses are out sick. Many of our doctors are out sick with COVID. We're having to pull from outpatient clinics. People who would normally be on vacation for the holidays right now are being asked to come in. And we're still short-staffed. We're still having a really hard time keeping up with the patient loads we have now. We are trying to do what we can to prepare for the inevitable increase we will see in the next couple weeks. But I am really concerned. I think people really are exhausted, and they're being stretched to the limit.
And obviously, you know, you had a situation where the administration, where the CDC said, okay, we're going to shorten the amount of isolation time. If you're asymptomatic, we know that you're less likely to give somebody else COVID. Earlier today, I spoke with the president of the Association of Flight Attendants. Her group is really upset with those new guidances, shortening isolation time. So I want to play for you a little of what she had to say.
Our concern is that this is putting all the onus on the workers. And when you put policies forward that are pro-business and not grounded in public health, it gives people reason to pause and not trust our public health requirement. People are worn out, and we've got to give them a break in order to take care of this country and keep the economy moving. This is a short-term fix that the CDC gave businesses that is going to have long-term pain.
Is she right?
I think the CDC recommendations would have been okay if they had included testing to come out of isolation at 5 days. And unfortunately, their current recommendation is 5 days of isolation and then 5 days of wearing a mask when back at work or around other people. We know people across the country are not reliably wearing masks. They're perhaps not wearing them at all, or they're wearing them below their nose or on their chin, which is absolutely useless for preventing the transmission of COVID. And I'm also hearing not just what you're describing with flight attendants, but from healthcare workers being told that after they've completed 5 days of isolation for COVID, that they're expected back at work. And I think many are concerned, well, what if I still feel sick after 5 days? Do I still have to go to work? And they feel like the expectation is, yeah, you need to be on the job.
So, I mean, it just almost seems like the problem is so enormous. If they can put that New York Times headline up again, I mean, even by the standards of this pandemic, which has been absolutely devastating, not only is New York City being pummeled by Omicron, but their new numbers show we're just about double the worst place where we have been. Single-day case record nearly doubling from the highest numbers from last winter. What do we do? What do states do? What do local governments do? I mean, you know, they're still going to have a New Year's Eve celebration in Times Square.
I mean, honestly, that gives healthcare workers like me palpitations and makes me feel nauseous to even think about that.
Literally nauseous.
Yeah, some states, literally nauseous. And some states, yeah, are calling in the National Guard, but how many National Guard are medically trained, are doctors or nurses? And so really, when you call in the National Guard, what they might help with is logistics, security at the hospital, maybe transporting patients from one part of a hospital to another, but they're not able to do the direct patient care where we really do need staffing to help us. And so there's only so much you can rely on those kinds of extra surge sources of staffing.
One of the things we talked about at the top of the show is the amount of stuff that's going out. Everything from gowns, you know, every piece of equipment you could maybe not possibly imagine, but an awful lot of stuff. And it was one of the things early on, right? We just didn't have what we needed. You couldn't even get a mask. We were being told not to get, not to buy the public, you know, really good masks because we needed them in hospitals. Do you at least have what you need to treat the people who are coming in?
In that respect, yes, it is a very different situation from the spring of 2020. In 2020, I had the same face shield that I was just cleaning day after day and using for months. Now I have as many face shields and masks and gowns and gloves as I want. So we are in a very different position with respect to personal protective equipment than we were at the beginning of the pandemic.
Well, at least on that positive note, we will say some things are going right, but hats off to you and to all the folks you work with there at Bellevue and all the doctors and nurses who are, again, fighting the good fight on the front lines. Dr. Celine Gounder, we appreciate it.